how does the laminar vascular dynamics work? So what happens is during the systemic inflammatory response, you get two things occurring at the same time: activation of leukocytes and the activation of the vascular endothelium. What does that mean? So the blood vessels basically have to separate. The blood vessel cells separate. These inflammatory cells can migrate through the lining of the endothelium. And what you also get is not only the movement of these cells, but the release of inflammatory mediators, which isn't very good for laminitis. And what happens as well is you get increased capillary pressure as a result of this. So you get laminar edema, increased arteriovenous shunting, and possible capillary collapse, because you have to understand as well that there are constraints in the hoof wall and the distal phalanx. And basically the laminar venules are more sensitive to this. And what happens is the leukocytes in this area release a lot of things, like PGF2 alpha, thromboxane, endothelin, isoprostanes, and some of these come from the platelets as well, which can be very harmful. The platelets in particular release histamine, serotonin, thromboxane, like I said, whereas leukocytes, they produce vasoactive prostanoids. And what you also have is something called MMPs, matrix metalloprostases. There are two types, and basically what you get because of them is degradation of the basement membrane between the two types of laminae, so the layers of laminae. So what happens is these laminae can't really adhere to each other anymore, which leads to the lamina separating, and they lose the support of the phalanx basically. So MMPs aren't good. And basically the way they're expressed, it's caused by bacterial toxins, like I mentioned, inflammatory cytokines, and a lack of oxygen in the area. And basically once we lose this adhesion of the laminae, the epidermal laminae in particular, to the underlying dermal laminae, so dermal laminae is under epidermal laminae, what happens is the forces on the hoof basically can't be supported anymore, and what this does is tear the remaining laminae and displace the distal phalanx. So what you get when the distal phalanx is displaced, there's a certain pattern in the hoof capsule, and it varies between horses, but sometimes between even each horse's foot. So one horse, each foot can be very different. So the distal phalanx may displace evenly around the circumference of the whole hoof wall, causing distal displacement or sinking. Or what you can also get is the distal phalanx displaces from the rest unevenly, and what you get is unilateral displacement. What this does is you get medial or lateral displacement or sinking of the distal phalanx, so it kind of goes into the hoof. And the most common pattern of asymmetric displacement, rotation of the distal phalanx, is when the dorsal distal margin of the distal phalanx moves distally and dorsally, and it diverges from the dorsal surface of the hoof wall. Sorry, there's a lot of D's there, but try and remember that. So there are 3 stages of laminitis. So you have the prodromal stage, that's stage 1. This is the period in which a horse is suffering from a disease and is at risk of laminitis. For example, you have the septic case of enterocolitis or surgical acute abdomen before you get laminitis. Then, so prodromal stage, then you have the acute stage. So this is when the horse is showing digital signs of laminitis, but you don't see anything in the x-ray, like displacement of the distal phalanx, like I mentioned. And stage 3 is the chronic stage. So this is the period after you displace the distal phalanx.